Hello, Learn STEM. This is the R in Learn STEM, and welcome to Bones and Bone Markings to Know. So this is going to be an Anatomy and Phys video, where I will just be going over the bones and the bone markings that you should know. First, these are the bone markings. So in your cranial bones, there is the frontal bone, your two parietal bones, there's a left and a right, your occipital bone, and your temporal bone. There's also left and right, but this one is only showing the right. Then there is your sphenoid bone right here. And then sutures are the ones connecting these together. This is the coronal suture that connects your frontal bone and your parietal bones. And you can remember that from the planes of the body, coronal or frontal plane. Same thing with your sagittal suture, which connects both of your left and right parietal bones. It's on the sagittal plane. And then here, your occipital bone to your parietal bones, that is your lambdoid suture. And between your temporal bone and your parietal bone, that is your squamous suture. So for our cranial bones, we're going to start with the temporal bone to see the bone markings. So this is your temporal bone. Hide the other one so we can focus on the temporal bone. And the markings that we need to know are, number one is the external acoustic meatus. And if you remember, a meatus is a canal-like structure. Your external acoustic meatus, we can derive from that acoustic, meaning, hearing, your ear, and then meatus being the canal-like structure. So that means our external acoustic meatus would be this part right here. Okay, here it is highlighted in red. Then next is your mandibular fossa. Remember, a fossa is kind of a shallow indent in the bone, would mean near your mandible, would be right here, this pink part, right underneath this part, which is your zygomatic process. And if you remember, the zygomatic bone is going to be right here. So it makes sense that the zygomatic process is the process that connects this temporal bone to the zygomatic bone. Next is your styloid process, which is this kind of pointy pink highlighted thing right here. And I remember that like a stylus, I guess, because it's kind of pencil shaped. It's really small and it's a process. So styloid process. Then finally, mastoid process, which is this part right here. And the process would be the part that juts out, because as you can recall, a process is defined as a projection or a prominence. So it can either be something small like this or something kind of bigger and more prominent right here. The next bone that we're going to look at for markings in your cranial bones is your ethmoid bone, and that is found right here behind the nose area. And we're just going to hide the others so we can focus on it. And what we're going to need to know here is the cribriform plates, the cribriform plates, which is this area right here. Here it is highlighted in pink. There is a lot of little holes there, foramina. The little holes are actually your olfactory foramina. That means related to smell, and that would make sense because if you recall, the ethmoid bone is behind your nose. Next is your crista galli, and what that is that prominence right here, highlighted in pink. Your perpendicular plate, which is this right here, your middle nasal concha, it's right here. This is your left middle nasal concha, and this is your right middle nasal concha. Next in your cranial bones is the sphenoid bone, and that would be, it's visible from the side over here. It's actually quite large because it connects most of the bones in your cranium. So let's hide the other bone so we can see better the sphenoid bone. It's kind of bat-shaped. It has a very distinct shape. The markings that you're going to need to know are, number one, the sella turcica. It's right here. It's posterior in the sphenoid bone. It's this area right here. And sella turcica, it means Turkish saddle. it looks like a saddle. So here it is, the sella turcica highlighted in pink. Next, what you need to know are the greater and lesser wings. It's kind of in the name. So this highlighted in pink is the left greater wing. So that would mean this is the right greater wing. And then these are your lesser wings because, they're smaller. Finally are your optic canals. And what you can derive from this is optic, like your eyes, and their canals. That's where the optic nerve passes, right here. So these would be your eye sockets, right? And those are your optic canals in your sphenoid bone. Then there are your facial bones, which is the palatine, your lacrimal, your nasal bones, your zygomatic bones, your vomer, your inferior nasal concha, maxilla, mandible, and also not present is your hyoid bone, but I will be showing that later. So now we are looking at the markings of your facial bones. We're going to start with your maxillae, which is just plural for maxilla because there's two, your left and your right maxillae. And what you're going to need to know all for this is just the alveolar processes, which just holds your teeth. And that's going to be the same for your mandible. It's also going to be called your alveolar processes. On to the bone markings of the mandible. Number one is going to be the body of the mandible, which is right here. Then the ramus, which is this part. There is going to be a left and a right. And finally, the angle of the mandible is going to be this highlighted pink part right here. Your coronoid process is going to be this part of your mandible. The mandibular condyle is going to be this part of the mandible. Finally, you are going to have your mental foramina, which are these little holes right here. And again, this is where knowing your regional terms are going to really help you out, because if you do know them, then you can recall that the mental region of your body is your chin. Now we're just going to quickly speed through the locations of the rest of the facial bones. So next are the zygomatics, like we discussed. It's kind of this cheekbone area. Next are the lacrimals, which are right behind your nasal bones. Speaking of nasal bones, they are right where you'd expect them to be. Next is the vomer, which is this middle plate right here. This is how it looks by itself. Next, the inferior nasal concha, which are right beside the vomer. There's a left and a right. This is one of them. This is the left side by itself. There is the palatine bone. We're gonna have to go a little bit low to find this because, like I said, it's the roof of your mouth. These are your palatine bones. Finally is your hyoid bone, which is this floating one right here, which wasn't displayed in the PowerPoint. Next is your vertebrae. There are 5 parts to it. There's your cervical vertebrae, and this is where knowing your regional terms really helps you out, because you know that the cervical is your neck region and thoracic is this region, and then your lumbar. Next is the sacrum and your coccyx. Right here it says there's 4 fused, but in reality it can be 3 to 5. To the vertebrae, the sacrum, which is made up of 5 fused vertebrae. So when we're looking at a typical structure, I'm going to click on this one in green. The parts that we need to know are highlighted. So this thick part is going to be the body of the vertebrae. This hole is going to be the vertebral foramen, and the spinous process is going to be this piece that's jutting out. And then finally, the transverse processes, there's 2 of them, are here and here. This structure as we go into the larger bodied lumbar vertebrae, where your lumbar region is. So again, we can see that this is the body, and it's much larger as you get further down the body. And again, this is going to be your vertebral foramen, then your spinous process, and your transverse processes once again. Another thing to note is that in your cervical vertebrae, there are special names for the first 2. C2 is called axis, and C1 is called your atlas. And The way you can remember this is if you're familiar with Greek mythology, Atlas is the name of the Titan that is punished by having to hold up the world on his back. You can kind of take it as the Atlas is holding up your entire world or your head, like where your brain is and everything. And finally, as we go down once again, we are at the sacrum, which, if you remember, is 5 fused vertebrae. And it's this highlighted in green right here. And what you need to know for this one is the sacroiliac joint surface. And how you can remember this is your sacrum, which is the sacral part, and then your iliac is right here. So sacroiliac joint would be this part right here. Your thoracic cage or your rib cage, and here you can see the sternum. Thoracic cage, which is made up of your sternum and your ribs. So for your sternum, you have your jugular notch. It's going to be this part highlighted in green. Then you have your manubrium highlighted in pink. Then you have the body of the sternum, which is this. And finally, your xiphoid process. Now looking at the ribs, there are 3 types: true, false, and floating. And in order to get you guys to properly see that, I'm going to turn on the cartilage. So how you can distinguish between true, false, and floating is like this. These 5 first ribs are going to be true since they each individually connect to the sternum. And these ribs down here, you can tell that they are fused and they all come together in groups to attach the sternum. So these are false ribs. And finally, these last 2 are not connected at all to the sternum, so they are your floating ribs. 2 markings of the ribs that you need to know. It's going to be the head, which is connected to your vertebrae. This is the tubercle of the ribs. So it's going to be found in all of them. You can see it's this little projection right here for all of your ribs. Next is your scapula, which is your shoulder blade. You probably know where that is, but it's like right behind. And this is part of your pectoral girdle. And you can see that the bone marking terms that we discussed are also present here. A spine, which is a sharp, slender process. And then your fossas, which are kind of shallow indentations. There are 2 bones in your pectoral girdle, which is your scapula and your clavicle, which is just your collarbone. So first, let's look at the scapula. For both of these, there's going to be a left and a right. So in your scapula, these are the things that you need to know. So this part right here is called the spine. Here it is highlighted in green. Next is the acromion, which I'm going to keep saying this over and over, but it will really help you out if you know the regions of your body, because the acromion is right in the acromial region of your body. Next is the supraspinous fossa and your infraspinous fossa. As you can probably piece together with the names, your supraspinous fossa is going to be above or superior to your spine, and your infraspinous fossa is going to be inferior to your spine. Then there is the subscapular fossa, which is on the other side, because if you think about it, sub is below or the other side of your scapula. So this is your subscapular fossa. It's going to be facing towards the anterior part of your body. Next, we have the glenoid cavity. This is your glenoid cavity or your glenoid fossa, and that's where your humerus articulates. And you can see right here the head of the humerus articulating with the glenoid fossa. The next marking of your scapula is going to be your coracoid process, which is going to be this part right across from your acromion. And again, this is the anterior view of your scapula. And finally, you have your lateral and medial border, which are also pretty self-explanatory. So your lateral border is going to be on the lateral side of your scapula, and the medial border is going to be on the medial side of your scapula. The second part of your pectoral girdle, which is going to be your clavicle or your collarbone. Again, there's a left and right. This is going to be your right clavicle and your left clavicle. And the 2 markings you're going to need to know are both ends. This is where your acromial area is. So this lateral end is going to be your acromial end. The medial end is going to be your sternal end since it's close to your sternum. If you're just given this bone, how you distinguish between the two ends is that the acromial end has a curve. This is your upper limb, which is made up of your arm or your humerus, and then your forearm, which is made up of the radius and your ulna. It's important to recognize that maybe if you get a test question and if it asks you about the arm, that would be your humerus. Like the entire thing, your humerus and your radius and ulna, that is not your arm because that is split up into arm and forearm. If it's referring to the whole thing, then it would, call it your upper limb. And then down here is your hand, which has 3 types of bones. It's your carpals, which is your wrist, your metacarpals, which is the bone in your palm, the bones in your palm, and your phalanges, which are your finger bones. Starting with the humerus. This one's kind of a doozy. So the first bone marking we're going to need to know is the head, which is right here. Like I said, this is going to articulate with your glenoid fossa of the scapula. So if there's a head, you know that there is going to be a neck. So that's right below here. Next is the greater tubercle, and this is the lesser tubercle. The pink is the greater tubercle highlighted, and now the highlight is on the lesser tubercle. Next is the intertubercular sulcus. Here is the intertubercular sulcus highlighted in green, the coronoid fossa, which is this part right here, the little indent on the anterior side of the humerus. Next, we have the radial fossa, which is going to be on the side of the radius as opposed to the ulna. It's right beside the coronoid fossa. So coronoid fossa, radial fossa. This highlighted in pink is going to be your lateral epicondyle, and this part highlighted in orange is going to be your medial epicondyle. Now, if we turn around the humerus to go onto the posterior side, there are more bone markings that we need to know. Next is going to be the olecranon fossa. This part highlighted in green, and this is where the olecranon of the ulna is going to connect to the humerus. Right underneath the olecranon fossa and medial to it is going to be your trochlea of the humerus. You're going to notice that with the names on the lower portion of the humerus, it's going to kind of match up with the bones of your forearm. Olecranon fossa is going to be the fossa which contains your olecranon of the ulna. So this trochlea is going to articulate with the trochlear notch of the ulna. We can kind of see it right now. The ulna is articulating with the trochlea of the humerus. So we're still posterior, and right next to the trochlea is the capitulum. And like the trochlea articulates with the ulna, the capitulum articulates with the radius of the forearm. Moving on to your ulna. It's going to be medial to your radius when you're in anatomical position, and let's get into the bone markings you should know. So first is the olecranon. As you can see, it took us to the posterior side of your ulna. It fits right into the olecranon fossa of the humerus. We can see it right here, the olecranon, fitting right into the olecranon fossa of the humerus. Next, we can see the coronoid process right here, highlighted in green, the coronoid process. Next, we have the trochlear notch. And if you remember, the trochlea is on the humerus, and it's where the trochlear notch of the ulna actually connects to. And we're still on the anterior side of the humerus, but we can move it around to the posterior side, and that is where the styloid process of your ulna is. It's going to be near your carpals. And finally is the radial notch of the ulna, and it's going to be right here. That is going to be where it articulates with the radius. Okay, a little speed run. So this is going to be your trochlear notch, radial notch, coronoid process, olecranon, and your styloid process right here. Okay, next is your radius right here. You're going to need to know where your head is, and that's highlighted in green right here. Then next, your radial tuberosity, which is going to be this area right here. Then next, you are going to need to know your styloid process. It's going to be similar to your ulna in that it is on the distal end of the radius. And finally, you have your hand. These are your 8 carpals, 5 metacarpals, and your 14 phalanges. Next is your pelvic girdle, which is the sacrum, coxal, and your hip bones, and is color-coded here. These are your hip bones with an S because there are 3 parts to it, even though it looks like it's one bone. And this is your sacrum and your coccyx. Here you can see the 3 parts of your hip bones. This is the ilium, it's the big part. And then the ischium, posterior and also inferior. And then your pubis is easy to remember because it's near your pubic region. The first bone we are looking at in your pelvic girdle is your ilium. And the first marking is the iliac crest. So that is going to be this part, this pink part of your ilium. The next marking we have is the greater sciatic notch. And if we turn around our skeleton to the posterior side, we can see it better. It's going to be this part right here, highlighted in green, is our greater sciatic notch. The next 2 bone markings we have are the anterior, superior, and inferior iliac spines. So the inferior iliac spine is below and the superior is above. The final marking we have to know for the ilium is one we already went over because, as you can recall, the sacroiliac joint surface is between the sacrum and the iliac bones. So this joint surface is going to be right here. The next marking we're going to be looking at is on the ischium bone, which is highlighted in green, and it is the ischial tuberosity, which we can see is right here on the posterior side of the ischium. Moving on to the pubis, the pubic tubercle can be seen right here, highlighted in green, and the pubic ramus can be seen right here. Remember, ramus is an arm-like projection. Finally, the final bone marking that we need to know for the pelvic girdle is actually right in between here. It's called your pubic symphysis because it's where the 2 cubic bones. Then next is your lower limb, and that is made up of your femur, your patella, your fibula, your tibia, your tarsals, metatarsals, and your phalanges. This is a little bit different than your upper limb because remember how the upper limb was made up of your arm and your forearm and your hand? This one is kind of inversed because the most proximal part of your lower limb, instead of being called your leg, it's called your thigh. And now the more distal portion is your leg. And there's 3 parts of the foot. In your femur, the bone markings consist of the greater trochanter, which is on the more proximal end of the femur, along with the lesser trochanter, which is just a smaller bump, and it's more posterior than the greater trochanter. Then you have your condyles. This one is the medial condyle since it is more medial than your lateral condyle. But along with that, there is also the medial epicondyle as well as the lateral epicondyle. Then you have the head of the femur, and this little indent here, that is called your fovea capitis. And finally, the last 2 bone markings on the femur are on the posterior side. So if we move our model here, we can see that the gluteal tuberosity, highlighted in pink, is kind of this ridge near the top of your femur. And as it goes down, it actually turns into your linea aspera. Now, as we move down from the femur, we have the patella, which is your kneecap, and you have your tibia, which is the thicker bone, and the fibula. So the bone markings of the tibia consist of your lateral condyle, which is on the lateral side, and it's, this condyle. And along with the lateral condyle, we have our medial condyle. Another bone marking of the tibia is this, which is our medial malleolus. And you'll notice that there isn't a lateral malleolus on the tibia because it actually is on our fibula, which we will see later. And the final bone marking on your tibia is your tibial tuberosity, which is, you can notice it's right between the medial and the lateral epicondyle. It's this little bump right here on the anterior surface of your tibia. Now looking at the fibula, which is lateral to the tibia, we have the head, which is near the top, and we have the lateral malleolus, which is distal to the head. And finally, we have our feet and our tarsals. There are two tarsals that we need to know, and that is the calcaneus and your talus. Those are the right side, and on the left side, this is your calcaneus and this is your talus. And finally, we know it's the same as your hands. There are 5 metatarsals and 14 phalanges, but you notice that there are only 7 tarsals, where in our hand there were 8 carpals. But with the addition of the patella, it actually turns out that there are the same amount of bones in your lower limb and your upper limb. So that was all of the bones and the bone markings that you needed to know. Thank you so much for watching this episode of Learn STEM. And if you enjoyed, consider subscribing, liking, checking us out on Spotify, Apple Podcasts, or wherever you listen to our podcasts. And also, we have an Instagram and a Twitter at Learn STEM for both. Thank you so much for watching. Actually, and comment down below your favorite emojis.